Social Security and Medicare changes for 2024 have been confirmed. I'm going to be covering all the details for you in this video. Let's take a look. Social Security benefits in 2024, 5 big changes retirees should plan for, and cost of Medicare premiums will go up in 2024. Here's how much. The amount that you pay for Medicare Parts A and B will be more expensive next year. Part D is going to be getting an income-related adjustment. As I said, I'm going to be covering all the details for you. And if you'd like to see a Social Security increase, stick around to the end. I've got some details for you. And on that increase for COLA, the cost of living adjustment, why it might not be what you think. Like I said, stick around to the end for some updates on that. But let's get you caught up on all the details. And before we do me a quick favor. If you appreciate the updates, take a quick second, smash the like button for me. Helps out a ton. Thank you so much. If you want to stay up to date, it's free. Why not? Hit the subscribe button, turn on the notification bell. And if you want to support the channel with a small monthly amount of like $5, I've also got the join button. No obligation, but if you want to, I appreciate it. Thank you so much. But with that being said, let's go ahead and take a look at these articles and dive right in. All right, so first let's take a look at Medicare and what came out this week on some of the changes that you can expect in 2024. Now, the final total that you can expect to pay for Medicare premiums in 2024 is out. The Center for Medicare and Medicaid Services announced Medicare Parts A and B are going to be getting more expensive, and some who receive Medicare's Part D will have to pay a cost adjustment depending on their income. Each year, the Social Security Administration determines what the costs associated with the Medicare program will be. It then either raises or lowers premiums and deductibles using rules set out in the Social Security Act. Here's how much prices could change if you receive Medicare's Part A, B, and D. In addition, if you receive Social Security, here's how much the COLA increase will be next year. Now, first, Medicare Part A costs are going to be going up in 2024. While roughly 99% of Medicare beneficiaries don't have Part A premiums, according to the CMS, costs associated with Part A are going up, and here's how much the increase will be. Inpatient hospital deductibles are going to be going up by $32. Daily hospital coinsurance for days 61 through 90 is going to be going up $8. Daily hospital coinsurance for lifetime reserve days is going to be going up $16. And skilled nursing facility daily coinsurance days 21 through 100 will have a $4 increase. So again, that's Medicare Part A increases that you can anticipate. Now, Medicare Part B is increasing in 2024 as well. Due to a new Alzheimer's treatment coming to the market, Medicare beneficiaries are expected to pick up the costs. Therefore, Medicare Part B prices will increase in 2024. The costs will go up from the current $164.90 to $174.70. That's an increase of nearly $10 a month. Now, how much less could Medicare Part D cost in 2024? While you may not see a huge difference in the amounts that you're paying for Medicare Part D, it still could be slightly lower. The average total monthly Part D premium is projected to decrease from $56.49 in 2023 to $55.50 in 2024, according to the CMS. Here's how it works according to the CMS. Now, the average total Part D premium is the sum of the average basic premium and the average supplemental premium for plans with enhanced coverage, and is the most accurate premium projected of what people will pay in 2024 for Part D premiums. Now, it's decreasing due to premium stabilization. 2022's Inflation Reduction Act redesigned Medicare Part D and provides a mechanism to limit premium increases for people enrolled in Medicare Part D, and an improved basic Part D benefit by capping annual out-of-pocket costs, limiting cost sharing for covered insulin products, and eliminating cost sharing for recommended adult vaccines in 2024. Now, although it's decreasing, the CMS said that there will be income-related adjustments to the monthly premium ranging between $12.90 per month to $81 per month, depending on salaries. Individuals with a salary of $103,000 or less, they won't see any changes. Here's what you can expect if your income exceeds that amount. Now, here's the CMS Medicare Part D. So for individuals with a gross income of $103,000 or less, there should be no monthly adjustment. You can see there that it's $206,000 or less for those that file jointly. Here are the different categories. You can go ahead and pause the video if you need, and you can see all the different monthly adjustment amounts for each income type. And what exactly do the different Medicare Part types cover? Well, here's just a quick recap for you. Medicare Part A covers inpatient hospital, skilled nursing facilities, hospice, inpatient rehabilitation, and some home health care services. Medicare Part B covers physician services, outpatient hospital services, certain home health services, durable medical equipment, and certain other medical and health services not covered by Medicare Part A. Medicare Part C, also known as Medicare Advantage Plan, is another option for receiving benefits. Medicare Part D helps cover prescription drug costs. And Social Security benefits are expecting big changes in 2024 as well. I've covered these here on the channel, but just a quick recap for you to remind you along with the Medicare changes. Number one, the cost of living adjustment is going to be going up. Now, the Social Security Administration has announced that benefit checks will rise 3.2% in 2024, but if you missed my video on it, there's a couple things that even with that 3.2% increase could bring down that bump up. So check out that video next if you missed it. The 3.2% adjustment will amount to about $59 of an increase in monthly benefits for the average retired worker on Social Security beginning in January of 2024. And specifically, the average check for a retired worker will increase roughly from $1,848 to $1,907. For a couple with both partners receiving benefits, the estimated payment will increase from $2,939 to $3,033, which is a rise of $94. And maximum taxable earnings are going to be going up as well. In 2023, the maximum earnings subject for Social Security tax was $160,200. That is, workers paying into the system are taxed on wages up to this amount, typically at a 6.2% rate. Well, in 2024, the maximum earnings will increase to $168,600, meaning more of the worker's income will be subject to the tax. Maximum Social Security benefits are also set to increase. As expected, the maximum Social Security benefit for a worker retiring at full retirement age will also increase in 2024 from $3,627 to $3,822. It's an improvement to note that the maximum applies to those retiring at the full retirement age, which is 67 for anyone born after 1960. Number 4, the average benefit for spouses and disabled workers is going to be increasing as well. The average benefit will increase across the board in 2024, and that includes benefits for people such as widows, widowers, and the disabled. Here's how those figures break down. The Social Security Administration says the average widowed mother with 2 children will see an increase from $3,540 to $3,653. Aged widows and widowers living alone will see their benefits increase from $1,718 to $1,773, and the benefits will increase for the disabled workers with a spouse and 1 or more children from $2,636 to $2,720. Of course, those are just averages, and individual circumstances will vary. And number 5, Social Security adjustments earnings test exempt amounts. If you claim your retirement benefit before you hit the full retirement age, Social Security will withhold some benefits from your checks above certain levels of income. It's what the program calls the Retirement Earnings Test Exempt Amount, and it can claim a serious chunk of your benefits if you're still working. Here's how it works in 2024. If you start collecting Social Security before full retirement age, you can earn up to $1,860 per month or $22,320 per year in 2024 before the Social Security Administration will start withholding benefits. At the rate of $1 in benefits for every $2 above the limit, in 2023, the maximum exempt earnings was $1,770 per month or $21,240 per year. Now, in the year that you reach full retirement age, this rule still applies, but only up until the month that you hit full retirement age and with much more forgiving terms. In 2024, you can earn up to $4,960 per month or $59,520 per year before benefits are withheld, at a rate of $1 of benefits for every $3 earned above the limit instead of $2. And in 2023, the threshold was $4,710 per month or $56,520 per year. So the bottom line is that in 2024, the Social Security COLA offers retirees and others better than average boosts for their benefits as a result of lingering inflation. However, I let you guys know here on the channel that there are going to be a couple things that could be eating away from that cost of living adjustment that you were anticipating. So if you missed that video, check it out right here, and also check out this video about potential increases that could be on the way. That is, once Congress gets a Speaker of the House, and we can get some legislation passed and through. But you guys, those are some of the big changes that have been confirmed that you can expect in 2024. Thank you so much for joining me, and I'll catch you in the next video. Take care. God bless. This is Steve.